Hello, we're going to do a central line dressing change today. So we've gathered our supplies. We have our central line kit, sterile, brand new, never been opened, of course. And we're going to do cap change. So, since we have 3 lines, we would technically then gather 3 caps and 3 sterile saline syringes. I'm just going to do one just to show you how to do it. So I've gathered my supplies. I have greeted my patient, told him what that we need to do, and had a little question and answer period here with him. I am going to open my sterile dressing kit. There should be 2 masks in here. I will put one on myself, one on my patient. If he doesn't have any kind of an upper respiratory infection, or he's alert and oriented and he can simply turn his head and keep it turned, that's okay. But otherwise, we'll put a mask on him. So I'm going to prepare my equipment as much as possible, because when I take my dressing off, I want to get it reapplied as soon as possible to avoid any contamination to the site. So I'm going to pick up my dressing from the corner, and I know that I'm on a overbed table, but I'm going to go ahead and lay it down. My intent was to, and I don't need all this space either, my intent was to pick it up far enough so I don't drag the edges of it over the table and contaminate it. I have my sterile gloves, and from this point then I might go ahead and open my cap, open it up, drop it out. And as far as my saline, these packages tell you that it's not actually to be used on a sterile field, but because it's kind of a modified sterile, I'm going to go ahead and do that. But I'm going to be aware that this isn't totally sterile, but actually that's okay. So I'm going to lay it over here to the side. Alright, so I don't have any clean gloves right now, but certainly I need to put on clean gloves then to remove my old dressing. I want to support the skin to keep from tearing the skin, because it's kind of a tender area. And certainly this is a plastic mannequin and not quite like real. So I'm going to go ahead and peel this back, again giving some support to the skin. Boy, this one's really stuck. It's been on there a few days. I'm also watching my sterile field and not getting over that. Okay, this line would be sutured in place, so it's not going to pull like that one just did. So anyway, I'll go ahead and put my gloves on. Kind of tight on the space here. Remember that you're going to, this glove is messed up. I'm going to pick it up by its cuff, and I can touch it anywhere on the outside of the cuff. It will be laying in the package with the thumb to the outside. Alright. point I need to get another glove. I'm trying to do this on limited space, and I would want you guys to make you an extra area to put your gloves on, because certainly there's not enough room here the way I've got this laid out. Alright. Good times. Alright. I'm going to be working with my fingertips anyway, so it's not going to matter. Once I've got my gloves on, I can reach in here, pull the things that I might need over closer to me. I'm going to need alcohol. At times, you might need to measure the length of your catheter. I'm going to go ahead and touch this just to show you. Like in some cases, maybe your catheter may be out so far, and then in that case you would certainly want to be measuring that each time, and that would be part of your documentation. It's not an issue here. And then sometimes you might need some gauze. We generally don't want to put them over the site, because then that occludes the site visually, and we want to be able to see if it's becoming reddened or anything to that effect. But sometimes maybe there's a skin tear caused by the tegaderm over to the side that you might want to fold up a piece of gauze and cover up so that it doesn't tear the skin any further. Maybe you need it if you have some drainage or something. Alright, so anyway, I have my ChlorPrep, and I'll need to break the ChlorPrep. I'm going to take one finger and secure, I'm going to push that back in there, secure my central line, and this will be like dripping and wet once I've broken it. I need to do a good vigorous scrub, and actually there will be enough liquid that you'll see some liquid go underneath your central line, that little part right there. I can't remember what to call it. Anyway, so I'm going to do, again, this nice vigorous scrub. I don't have to do the inner to outer thing with the ChlorPrep, just by the nature and according to the manufacturer's instructions. Anyway, and I will then end by going down the lines again and going even outside of the dressing, where I'm basically just trying to decrease the bacteria. Alright, so I'll drop that. I'm going to allow that to air dry, and then I will replace my dressing. Again, as I said, you want to get that dressing back on as soon as possible. Remember to drop things from a distance now when you've got your sterile gloves on. And once I get my dressing on there, then I am good as far as sterility goes. I don't have to be sterile any longer. All right. Okay, I would lay this down because the last thing I'm going to do then is write my date, time, and initials on here. Certainly I'm going to wait till I'm finished right now. So I'll lay this over to the side. Okay, so I want to then prepare my saline, hold it straight up and down, and actually pull down on your plunger first to clear any saline that's up around the top so it doesn't spit, and then run it up, get all your air out, attach it, wrong end, and then you want to prime your cap. Alright, so I've got that ready. And I want to open my alcohol, and with my cap changes, then what I'm going to do then is cleanse this portion here at the connection. At the same time, I am also decontaminating my gloves, which is kind of a little help there. Kind of decrease the germs. So basically you're decreasing the potential for contamination as you change the cap. Okay, so I have it decontaminated, and I have the cap off of my little cap there. And what I'm going to tell my patient then is to bear down like he's going to have a bowel movement, which is the Valsalva maneuver. Although, and then I would quickly change the cap. The reason for that is I don't want basically to suck air. But I do have a slide clamp here, so that also decreases the incidence of the potential for drawing air into the line. So anyway, I'm going to tell him to deep breath in, hold it, and bear down, and then I will quickly then change the caps. At this point then I would open the slide clamp and then forcefully flush the line according to your facility policy, which, you know, it may be the full 10, it may be the 10 of saline, and then likely then you would also follow it with heparin. And I would continue on and do that for each of the 3 lines. And that is the end of that.